If you've been dealing with that nagging ache in your shoulder, the kind that makes reaching for a coffee mug feel like a chore, or turning over in bed a sharp reminder that something's wrong, you're not alone. Millions of people experience shoulder pain every year, and it can stem from something as simple as poor posture during your workday or as complex as an underlying injury that's been building up over time. The good news is that understanding your shoulder, recognizing the common causes, and learning practical ways to manage and prevent the pain can make a huge difference in getting back to feeling normal. Let's dive deep into this topic so you can take control of your shoulder health today. First, it's essential to understand the anatomy of the shoulder because it's one of the most complex and mobile joints in your body. The shoulder isn't just one joint, it's a sophisticated system made up of three main bones: the humerus, your upper arm bone, the scapula, shoulder blade, and the clavicle, collarbone. The primary joint, called the glenohumeral joint, is a ball-and-socket setup where the rounded head of the humerus fits into a shallow socket on the scapula called the glenoid. This design allows incredible range of motion. You can lift your arm overhead, rotate it, reach behind your back, but it also makes the shoulder inherently unstable compared to, say, the hip joint. To keep everything stable, there's the rotator cuff, a group of four muscles and their tendons, supraspinatus, infraspinatus, teres minor, and subscapularis, that wrap around the humeral head like a cuff, holding it securely in place while allowing movement. Surrounding this are bursae, small fluid-filled sacs that reduce friction, ligaments for support, cartilage for smooth gliding, and larger muscles like the deltoids that power big movements. There's also the acromioclavicular AC joint where the collarbone meets the shoulder blade, and the whole system relies on good coordination with your neck, upper back, and even core for proper function. When any part of this intricate setup gets irritated, inflamed, or damaged, pain sets in, often limiting your daily life. Now, let's talk about the most common causes of shoulder pain, because identifying the root can guide you toward relief. By far, the leading culprit is issues with the rotator cuff. Rotator cuff tendinitis or impingement happens when the tendons get pinched under the acromion, the bony roof of the shoulder, during overhead movements, leading to inflammation, swelling, and that classic ache when lifting your arm. This is incredibly common in people who do repetitive overhead work, like painters, electricians, or even desk workers who hunch forward all day, or athletes involved in throwing sports. Over time, this can progress to bursitis, where the bursa becomes inflamed and swollen, adding to the discomfort. Rotator cuff tears are another big one. They can be partial or full and often result from acute injury, like falling on an outstretched arm, or gradual wear and tear with age. You'll feel weakness, especially when trying to lift or rotate your arm, and pain that worsens at night. Frozen shoulder or adhesive capsulitis is a frustrating condition where the joint capsule thickens and tightens, severely restricting motion. It's more common in people over 40, especially women, and those with diabetes or thyroid issues. Arthritis, particularly osteoarthritis, wear and tear type, erodes the cartilage, causing grinding pain and stiffness. Other causes include dislocations or instability from trauma, referred pain from neck problems, fractures, often in older adults from falls, or even overuse strains from activities like weightlifting without proper form. Sometimes, pain comes on suddenly after heavy lifting or a twist, but more often it's gradual from poor posture, muscle imbalances, or sleeping awkwardly on one side night after night. The key takeaway: most shoulder pain isn't from a single dramatic event but from accumulated stress on this highly mobile joint. So, how do you find relief? Many cases improve with conservative, at-home strategies before needing professional help. Start with the basics. Rest the shoulder from aggravating activities, but don't immobilize it completely. Gentle movement prevents stiffness. Apply ice for 15 to 20 minutes several times a day to reduce inflammation, especially in the first few days of flare-ups, and consider over-the-counter anti-inflammatories like ibuprofen if your doctor approves. Good posture is a game changer. Sit and stand tall, keep screens at eye level, and avoid slouching to reduce strain on the rotator cuff. But the real powerhouse for relief and long-term healing is targeted exercises and stretches. Begin with pendulum swings. Lean forward, let your painful arm hang loosely, and gently swing it in small circles like a pendulum for a minute or two. This promotes blood flow without stress. Doorway stretches are excellent for opening the chest. Stand in a doorway, place your forearms on the frame, and lean forward gently to stretch the front of the shoulder. Cross-body stretches, where you pull one arm across your chest with the opposite hand, target tightness. For strengthening, try external rotations. Lie on your side with a lightweight or resistance band, keep your elbow tucked at your side, and rotate your forearm outward. Wall slides or scapular squeezes strengthen the upper back muscles that support the shoulder. Aim for gentle, pain-free movements. Start slow, 10 to 15 reps, building up gradually. Consistency is key. Doing these a few times a week can significantly reduce pain and improve mobility over weeks to months. Of course, prevention is always better than cure. Strengthen your shoulders regularly with balanced exercises. Focus on the rotator cuff and scapular stabilizers to build resilience. Warm up before any physical activity. Use proper form during workouts. Avoid locking elbows or shrugging shoulders, and incorporate breaks if your job involves repetitive motions. Maintain good overall fitness, including core strength, because a strong midsection supports better posture and shoulder mechanics. Ergonomics matter. Adjust your workspace so your arms are supported, and vary positions throughout the day. If you're into sports, work with a coach on technique to avoid overload. And listen to your body. If something feels off, scale back early. That said, not all shoulder pain resolves on its own, and knowing when to seek professional help is crucial. See a doctor promptly if the pain is severe, follows an injury with swelling or deformity, if you can't move your arm at all, or if there's numbness, tingling, or weakness suggesting nerve involvement. Persistent pain lasting more than a few weeks, night pain that disrupts sleep, or symptoms that worsen despite rest and home care warrant evaluation. It could indicate a tear, significant impingement, or something needing imaging or therapy. A physical therapist can provide personalized exercises, while an orthopedist might recommend injections or, rarely, surgery for stubborn cases. Shoulder pain doesn't have to define your days. By understanding the anatomy, addressing common causes head-on with rest, ice, posture corrections, and dedicated exercises, and prioritizing prevention, you can reclaim comfortable movement. Start small today. Try a gentle stretch, adjust your posture, and build from there. Your shoulders carry a lot, literally and figuratively. Give them the care they deserve, and they'll support you through everything life throws your way. If pain lingers, don't hesitate to get expert guidance. You deserve to move freely and without discomfort. Take that first step toward relief now, and feel the difference. If you found some relief from the basics we covered earlier, that's fantastic. Many people see big improvements just from posture tweaks, gentle stretches, and consistent strengthening. But shoulder pain can be stubborn, and there's so much more to explore to truly understand, manage, and overcome it for good. Let's go deeper into advanced strategies, common misconceptions, lifestyle factors that quietly sabotage your progress, and even alternative approaches that have helped countless others when traditional methods fall short. The goal is to equip you with a complete toolkit so you can tailor your recovery to what your body truly needs. One area often overlooked is the role of surrounding structures in shoulder pain. Your shoulder doesn't work in isolation. It's deeply connected to your neck, upper back, and even your core. For instance, thoracic spine stiffness, that's the middle and upper part of your back, is a hidden contributor in up to 80% of chronic shoulder issues. When your thoracic spine lacks mobility, your shoulders compensate by overworking, leading to impingement or strain. Simple thoracic extensions, like lying over a foam roller placed horizontally under your upper back and gently arching backward, can unlock this area and take pressure off the shoulders almost immediately. Similarly, neck tension from forward head posture, common in anyone staring at screens, can refer pain directly to the shoulder blade or top of the arm. Try chin tucks. Pull your chin straight back as if making a double chin, hold for a few seconds, and repeat throughout the day to realign your head and ease that referral. And don't forget the scapula. Your shoulder blade needs to glide smoothly on your rib cage. Scapular dyskinesis, or abnormal movement patterns, often stems from weak serratus anterior muscles, the ones that protract the blade forward. Exercises like wall push-ups with a plus, pushing your chest away from the wall while protracting your blades, or serratus punches with a band can rebuild this foundation, leading to smoother, pain-free overhead motion. Sleep position is another massive factor that either heals or hinders your shoulder overnight. If you're a side sleeper on the painful side, gravity compresses the rotator cuff for hours, worsening inflammation by morning. Switch to sleeping on your back with a pillow under your knees for comfort, or if you must side sleep, hug a body pillow to keep your painful arm supported and neutral. This prevents it from falling forward and pinching structures. Avoid stomach sleeping entirely, as it forces prolonged rotation of the neck and shoulder. Investing in a supportive pillow that keeps your neck aligned can make a world of difference too. Nutrition and inflammation play subtle but powerful roles in recovery. Chronic low-grade inflammation can prolong tendon healing and amplify pain signals. Focus on anti-inflammatory foods. Fatty fish like salmon for omega-3s, berries, turmeric, with black pepper for better absorption, ginger, olive oil, and plenty of colorful vegetables. Stay hydrated. Dehydration thickens joint fluid and reduces cushioning. Supplements like glucosamine, chondroitin, or collagen peptides show promise for joint health in some studies, but check with your doctor first, especially if you're on medications. Conversely, cut back on processed foods, sugar, and excessive alcohol, which fuel inflammation and slow tissue repair. Stress management might sound unrelated, but it's not. Emotional tension often manifests as physical tightness in the shoulders and neck. Chronic stress raises cortisol, which impairs healing, and many people unconsciously elevate their shoulders when anxious. Practices like deep diaphragmatic breathing, inhale for 4 counts, hold 4, exhale 6, progressive muscle relaxation, or even short daily meditation can lower that baseline tension and reduce pain perception. Pair this with mindful movement like yoga or Tai Chi sequences designed for shoulders, flows that emphasize gentle rotations and openings without forcing range. For those with persistent pain, exploring alternative therapies can open new doors. Dry needling or acupuncture targets trigger points in muscles like the infraspinatus or trapezius, often providing quick relief from knots that refer pain. Massage therapy, particularly myofascial release, can break up adhesions in the rotator cuff or capsule. Some find success with topical treatments like arnica gel or capsaicin cream for surface-level soothing. Low-level laser therapy or ultrasound in a clinical setting accelerates tissue healing for tendinitis. And emerging options like platelet-rich plasma, PRP, injections use your own blood components to promote repair in chronic tears, though these are more advanced and not first-line. Common pitfalls trip up many on the road to recovery. One is pushing through pain. Thinking no pain, no gain applies here. With shoulders, pain is a signal to back off. Forcing movements can tear fragile tissues further. Another is neglecting eccentric strengthening, the lowering phase of exercises, which is crucial for tendon resilience. Try slow controlled lowers with light weights. Imbalances are sneaky. Overdeveloped chest muscles from bench pressing without equal back work pull the shoulders forward, worsening impingement. Always balance pushing exercises with pulling ones, like rows or face pulls. And rushing return to activity. Gradual progression is key. Too soon, and you'll re-injure. Long term, think about building bulletproof shoulders. Incorporate full-body functional training, carries, Turkish get-ups, or overhead presses with perfect form once pain-free. Mobility work daily, strength 2 to 3 times weekly, and recovery practices like sauna or contrast showers to boost circulation. Track your progress. Note pain levels, range of motion, and sleep quality weekly to stay motivated. Remember, while most shoulder pain resolves with patience and the right approach, some cases need specialized care. If you've tried consistent conservative measures for 3 to 6 months without improvement, or if red flags like unexplained weight loss, fever, or progressive weakness appear, seek thorough evaluation. MRI or ultrasound can reveal hidden issues like labral tears or calcific tendinitis. You've already taken a huge step by educating yourself on this. Layer in these deeper insights gradually. Start with sleep adjustments and thoracic mobility this week, add nutrition tweaks next, then explore stress reduction. Your shoulders have incredible healing potential when given the right support. Keep listening to your body, celebrate small wins, and stay consistent. You're building not just pain relief, but lasting strength and freedom of movement. The discomfort that's held you back can become a distant memory. Commit to this journey, and watch how capable and resilient your body truly is. You've got this, one mindful step at a time.